Well, good morning, everyone. I want to first thank ODI and express my appreciation for the opportunity to be here today. And maybe before I start, just to set a little bit of context about myself and where I work within the foundation. I'm managing director for the foundation's donor government relations. We're charged with managing relations with some 16 governments across 4 different continents here in Europe, but also the Middle East, North America, and the Asia-Pacific region. My team is part of the Global Policy and Advocacy Division at the Foundation, which sits alongside global health and global development, and over the past several years has been one of the fastest growing divisions within the Foundation. Before my current role, I was Director of Global Health Policy and Advocacy at the Foundation, responsible for helping to increase overall resources devoted to global health, for advancing policy reforms and building political champions and public will on the issue, and in particular the Foundation's health priorities. Policy advocacy are still relatively new functions, thank you, at the Foundation. Not long ago, there was a sense that the Foundation's role should be to find the best and brightest out there working in global health and to provide some additional financial resources to help organizations scale some of their work. But it became very clear that even with the Foundation's resources and resources that we were very fortunate to receive from Warren Buffett, that these would be a drop in the bucket compared to the kinds of issues that we were working in on HIV/AIDS and malaria, nutrition, maternal health, that we really needed to try to do whatever we could to marshal additional resources. And that took us to governments to tackle some of the challenges that we wanted to. So what we needed to do is just understand a bit more what would be the best way to leverage some of that additional funding. So about a decade ago, the Foundation began to ramp up its advocacy efforts along with communication with the hope of really expanding the impact that our organization could have on its own. Which brings me to the present, and I'm very pleased to be here because we believe the discussion about development progress is critical. At the Foundation, we're really excited about the dramatic progress that we're seeing in the developing world, and we're quite optimistic about the future. One of the indicators that we track most closely is child mortality, which has been in steady decline over the years. And accelerating, that progress has been accelerating, especially since the year 2000. 4 African countries, for instance, have already reached MDG 4, Ethiopia, Tanzania, Malawi, and Liberia. And together it's a population of tens of millions of people. So we're starting to see dramatic change at scale. But despite the progress, the public, and especially the public in donor markets, are still convinced that development isn't working, that ODA investments to address poverty are a waste or not as effective as they could be. So it's a narrative we try to counter every day at the Foundation, not only because we're impressed by the dramatic progress that has been achieved, but also because we believe that securing public support for ODA is necessary to maintain global efforts to safeguard financial resources that we think are going to be critical to supporting the acceleration of this unfolding and, in many cases, good news story. Our concern about the negative ODA narrative is not always based on evidence. Our concern about the narrative, the negative ODA narrative, is that it's not always based in evidence and instead heavily influenced by negative media articles. So we're glad to be able to partner with ODI on the Development Progress Project to try to really understand better and support evidence that uncovers successes in development and also examines how these gains have been achieved, which we then hope will inform future action in developing countries. So once again, grateful for the opportunity to be here. Let me give you one concrete example of why we're convinced that promoting the facts about progress is so important, and that's why we wanted to work with ODI and support the Development Progress Project. In 2010, the world marked the 2/3 point of the time period for the Millennium Development Goals. We were fully ensconced in the Great Recession, and as we approached the UN General Assembly that year, there was a real thread in the media about how poor countries, especially in Africa, were failing on the MDGs and how the UN once again had set a set of lofty goals that made no impact. With donors already facing budget deficits, there was a real threat that MDGs would be declared a failure, and instead of doubling down to accelerate progress in the remaining 5 years, the MDGs would be swept under the rug. So we decided we needed to contribute to a fact-based conversation about the tremendous progress that was and is happening. Our policy and advocacy team made our first grant to ODI to fund an MDG report card study that ranked countries based on their MDG performance. The report showed how MDG progress measures based on the percentage of target achieved masked impressive progress in countries with low starting points. For example, in Thailand, which reduced under 5 mortality from 31 to 7 deaths per 1,000 live births between 1990 and 2007, was credited with a 77% reduction in mortality and is recognized as a top performer on MDG-4. Yet Niger, which reduced under 5 mortality from 304 to 176 over the same time period, is not as well recognized, even though it's smaller, but still dramatic 42% improvement saves more lives per 1,000 births. That 2010 report found that in the global MDG process rankings, Ecuador, China, Thailand, Brazil, and Egypt were notable top performers by the standard relative progress measures, but it was Benin, Mali, Ethiopia, Gambia, and Malawi that saw the highest absolute improvements and received less recognition for their own advancements. Of the top 20 performers on absolute progress identified in the report, rather than percent progress, 11 were from sub-Saharan Africa, which to us illustrated that some African countries are far from failing and in fact doing impressively well at fast-tracking their development objectives. A key takeaway message for us is that how you measure progress affects your perception of what it means to succeed and which countries are saving and improving lives. We hope that this lesson was heeded as we set the next round of development goals and think more about fine-tuning targets to account for country starting points. The scorecard got quite a bit of attention during the UNGA, and with a lot of other partners working to echo the message that progress is possible and progress is happening. But clearly we can't rest, and as we see in publications like the Daily Mail, development fatigue and skepticism might be on the rise. We make our investment in the Development Progress Project on the theory that more and more well-documented examples of sustained large-scale progress in poor countries will help advocacy partners and media communicate better with the public and policymakers about what is going well in the developing world, and so make a stronger case for continued investments in development of poor countries. Secondly, by carefully unpacking the ingredients of progress, we learn more about the interventions that are making an impact and important contextual factors like political buy-in, as Kevin just mentioned. We need more of these kinds of studies of development progress for several reasons. The first of which is to empower advocates with more and better examples of development opportunities. Second is to provide policymakers and donors with clear examples of positive momentum in the developing world that deserve to be supported and reinforced. Third is to point researchers towards understudied cases of development progress that could yield more lessons in future development aid and work. And finally, to help inform the media and to inspire broader public debate about opportunities for investing in development with compelling stories about the potential for making positive, long-lasting change in the developing world. We'll have an opportunity in this session, I hope, to hear more about some specific case studies and what's helped catalyze progress in some of the countries highlighted this morning. And through the Gates Foundation's investments, we see a host of factors that have contributed to major improvements in health, and I'll talk about just a couple. One that we see is in vaccination. Millions of children have been vaccinated and millions treated for diseases and protected with bed nets through innovative partnerships like Gavi and the Global Fund. And I think it's not accidental that we've been able to demonstrate dramatic progress and proven results, like those that we've seen over the years in health, we're seeing strong financial commitments follow. Last year, for example, we saw an historic $12 billion pledge for the Global Fund. And last week I had the opportunity to be in Toronto where Prime Minister Harper there announced a renewal of Canada's Muskoka pledge with a 3.5 billion Canadian dollar pledge over the next 5 years to maternal, newborn, and child health programs. And we hope to have a similar set of bold commitments this year or early next with the replenishment of Gavi. In Ethiopia, where the foundation does a lot of work, investments in community health centers, including some of the most rural areas, staffed with strong community health workers, are delivering a continuum of care, including the provision of medicines, vaccines, and family planning services, antenatal care, and birth assistance. And the kind of progress that we're seeing in countries like Ethiopia can happen in almost all developing countries. In fact, a recent study from the Commission on Investing in Health found that it is possible to achieve what they characterized as a grand convergence in health, where low-income countries can converge to the mortality level of the best-performing upper-middle-income countries within the next 20 years. And not only will this deliver good health and improved quality of life, but economists who worked on that report documented that investing in health could yield a 9 to 20 times investment, or return on investment. And yet, despite all of this hope and progress, we still face a lot of public skepticism. Frustrated by this gap in understanding, Bill Gates made foreign aid myths a focus of his 2014 annual letter earlier this year, and he wrote about his belief that life is better for people around the world than it's ever been, but there's much work to do to make sure that everyone can live a healthy and productive life. Unfortunately, the myth that poor countries are doomed to stay poor still clouds public support and is standing in the way of progress that can save millions of lives and help countries prosper. But if more people know the truth about how much progress the world is making, we will be willing to learn more about what's worked, accelerate the progress, and make bigger strides towards a world where everybody can prosper. Development advocates, including the Gates Foundation, must continually make the case that investments in development are strategically important and practically effective. And as rigorous as we are with our data collection and analysis, so should we be with the science of delivering that evidence, and not just to those in the sector, but people who may not think of these issues on a regular basis. It's why we spend a lot of time and effort these days considering a more contemporary narrative on aid to advance a tired and outdated storyline about how the world is trying to tackle extreme poverty. And this starts with trying to figure out what are commonly held views about aid and development in more places around the world so that we know better the kinds of information and analysis that people are most likely to be interested in engaging in. We need systematic, accessible stories of progress, so we really appreciate ODI's efforts to do this and communicate this progress in new and very exciting ways. Thanks very much.
Thanks, Jeff.